Okay, so for you heavy metal fans,
You
we'll
are
tell you
on
why.
fire today.
I know. We'll tell you why. We'll tell you why I said that. But for you heavy metal fans who are looking up mercury for everything and or peripheral neuropathy, there's such thing as mercury peripheral neuropathy, and I say that because Dr. Gates mentioned we do these in series. We've done a few of these already today, and Dr. Gates mentioned in an earlier hangout that we did. That we were talking about doing heavy metal testing and heavy metals relative to chronic pain and so on and so forth a couple of weeks ago. Well, we didn't do it because it's still kind of a vague area. There are people who are dogmatically, it's all about heavy metals. I'm one of the people who took the fillings out of my teeth because I had all these crazy problems and I had no change at all. But I have had patients who took the fillings out of their teeth and had significant change. So it's still a big gray area, but there's some certainty in certain areas in the heavy metal world. We do pretty thorough evaluations before a patient ever even is considered for care here. And in the pretty significant, pretty extensive history that we do, we probably spend an hour taking the history in addition to a 17-page document that we put together for specifically, well, it used to be 41 pages.
I know.
You remember that?
I'm laughing because we have a patient right now who's just, she's like, oh my gosh, this is so much work.
Yeah. Well, but that's what it takes to figure it out. And the point I was going to make is we kind of go more or less off of the symptoms as to whether we think there's a heavy metal issue going on or not. So we don't have the dogmatic, all of this, it's all heavy metals, right. It's all this, it's all that. There's so many things. There's 80 different things that can lead to a person's peripheral neuropathy. Heavy metals, particularly mercury, happens to be one of them. And so Dr. Gates would like to discuss that aspect with you. We have a recent patient who is going through this very problem. And so maybe he can help those of you who are looking into peripheral neuropathy and whether mercury is the problem to kind of sit there and go, okay, I should look further into that, or maybe I don't need to look further into that or whatever. So Dr. Gates is the head of our tech department here, which means he does all the treatment. He's the one who's working with all the patients one-on-one directly. He's the one who sees all the patterns. He's the one who does all the research. I just sit here and do this.
I don't think we comment, though. You're a certified functional medicine practitioner. I'm a board-certified chiropractic neurologist, and so we've melded our disciplines. Yeah. But basically, for those of you out there with peripheral neuropathy, lots of times people have idiopathic peripheral neuropathy, cryptogenic peripheral neuropathy.
We're going to talk about that next.
Yeah, that'll be next, but I'm just going to touch on it because lots of times then people say, well, I don't have diabetes, so maybe it's heavy metals. Because there's this big heavy metal world out there, and lots of alternative practitioners say, it's the heavy metals, and it can be the heavy metals. But what we have to look for you is your history suggestive of heavy metal exposure, A. Right. B,
symptoms of heavy metal exposure.
And you have symptoms and signs that match that of mercury toxicity relative to peripheral neuropathy. It's really pretty specific. For mercury-based neuropathies, most commonly, the person will have more muscle weakness and muscle involvement in their legs and their feet than they will lack of sensation. It's not to say you won't have a lack of sensation, but the muscle weakness will be far more profound than that seen common with things like diabetic peripheral neuropathies and some of the other garden variety peripheral neuropathies. Also, in that setting, lots of times the person will have a tremor with their hands outstretched. So they'll go to touch something and their finger will do this, or their arms will do this when they're out this way. That basically narrows it down to a couple possibilities. It can be one other type of heavy metal, and it can also be a form of a genetic neuropathy termed Charcot-Marie tooth, and it's type 2, if I remember correctly.
More than a handful.
Yeah, and we've seen those too, where there is that tremulousness. Yeah. And if there needs to be validation, lab tests can be run relative to heavy metals, but know this is an area that is incredibly contentious, not agreed upon. If you have acute mercury toxicity that can result in peripheral neuropathy, you can run something called a blood test to test for the mercury toxicity. However, lots of times if, let's say, you think you're exposed to mercury 20 years ago, the blood tests oftentimes aren't going to show whether or not you had that heavy metal poisoning, which raises a question. Some people say get a hair test. We don't like the hair test. We will, in those settings, use a urine test, but again, it's still contentious. Know that. We know that, so you know that. And that's where people will go to a doctor and they'll urinate, and then they take an agent that tries to pull metals out of their body to see how much metal is there, and then they urinate again, and you see the coefficients of all the different metals. So basically, that's the skinny on mercury toxicity, and that is why it's semi-difficult to diagnose. And I just give you that background data because in the neurological text they talk about this dilemma a lot. And we see it clinically too, where lots of times patients will see their medical neurologist and a blood test may be run, and lots of times medical neurologists get upset too because they say, half the time it's diabetes and half the time we have a hard time figuring out what the cause is.
Yeah.
But just know if you have that clinical presentation, you think you're exposed to mercury, you may want to get evaluated and see your neurologist or other practitioner.
And just to emphasize, it is a clinical, it frequently has to be a clinical diagnosis. And
Right.
what I mean by that is emphasizing the history. Much of what we do, frankly, has to be a clinical diagnosis because the testing just isn't there. It isn't consistent enough. It's controversial. It's not particularly reliable. In our experience, and this is what we do. This is what we do for a living. I mean, trust me, if there was a test that was like, boom, we'd be telling you what it is. And because we would have figured it out by now because we've tried them all. But I do, the reason I mention this is because I get a lot of people come in and they're a little insecure with the fact of making a diagnosis based on an extremely thorough history and an extremely thorough exam. Frankly, that's really how you're going to figure this out most of the time. Then if you do the urinary test for heavy metals, if it comes up gluten, gluten's another area where the testing's all over the place. But if it comes up mercury, or if it comes up whatever metal we're looking for and that happens, well then, okay, fine. But if it doesn't, I mean, that's still going to be, there's a differential diagnosis.
Right. Exactly.
And then you would want to go after it that way, even though the test is normal. Okay, so even though the test is normal, so as Dr. Gates puts out, it's a diagnostic challenge, but it does exist. We've had patients with it, and it's a tough one.
Mm-hmm. Absolutely.
Tough one.
Just because mercury has destructive effects on the nervous system. So, and we just did a whole talk today on glutathione and how glutathione pulls heavy metals out of our body, and lots of times some of the one camp in the heavy metal world says that certain people are accumulating things like mercury just because their body doesn't get rid of it. It's not that you got exposed to so much of it. It's just that your body doesn't get rid of it at the same rate as everybody else. We've all heard of the stories of, when grandma was young, she used to swim out in the pond that was full of mercury, and she used to play with it, and she used to inhale it. And grandma has no neurological deficits, where someone else, brushes against a minor, and all of a sudden they have mercury toxicity.
Yeah, or washes their husband's clothes.
Yeah.
We have a patient right now who
Right.
washes her husband's clothes who worked in the mine. And it turns out she had heavy metal problems, and she's getting detoxed from the heavy metals with glutathione, vitamin C, and heavy metal.
Mm-hmm. We refer her to another doctor.
We refer her to another doctor, right?
Yeah.
We don't do that. And she's doing fantastic. So.
Right. And she has peripheral neuropathy too.
And she got it from her husband's clothes that she was washing. So huge difference in potential sensitivity.
Okay.
I think
that's pretty.
Okay. Hope that answered any questions you might have.
If you have any other questions, go to
this topic.
Go to powerhealthtalk.com or like us on our Facebook page, and we can answer you there. Thanks for watching.